guest is Dr. Carolyn Delucia. She's an OBGYN and founder of Viva Rejuvenation Center and V-Spot Med Spa. I love it whenever I see a female doctor. High five there.
High five
I think we're
to
matching
you.
with our little necklace down there. So tell me, I mean, as a woman doctor, right? What do you think about this huge, I feel, explosion in finally the interest in women's health and vaginal health?
Yeah. Well, first of all, it is a very underserved area. It is an area that we really need to address. We need to address it now. Women are tired of suffering in silence.
And millions are suffering.
Oh, terrible. From all the experiences throughout our lives, from the first time we become reproductive until the day we die and stop being sexually active. So all of that time, we want to stay healthy and vibrant. So with that, I wrote a book.
Really? Tell us about it.
Yeah, I just wrote a book. It's for the layman. It's not for physicians, although it may have a place in the doctor's office as an informative piece for their patients and clients. And it's called Ultimate Intimacy. And it's the revolutionary science of female sexual health. It's available right now on pre-order on Amazon.com, and I have it this weekend for the whole big price of 99 cents.
Wow. Guys, make sure to get it. Because, they ask me all the time, how do you talk to patients about it? Because, as a cosmetic dermatologist, obviously, it doesn't even occur to them that I offer these procedures. How do you get people, women, talking about it? Because we're so used to not talking about it. We don't even talk to our sisters, our moms about it.
Correct.
And so what would your advice be?
Well, I think for the doctor's office, my biggest recommendation is to have some form of signage in the office, but in a private space. Like a little sneaky poster behind the door of the ladies' room, or a little sign on the back of the restroom, so that they see it and it spurs the conversation. Like, excuse me, doctor, you have something that might help me with this condition? And then they'll be all over it, and it opens the conversation. And we as physicians have to get past the fear of discussing sexual health.
Well, it makes sense for women to talk to you about their vaginal health because you're an OBGYN, but what would your advice be for the non-OBGYNs, who are interested in this field?
Well, I'm going to tell you a little secret. I understand that there's a gap that needs to be crossed. That gap is that cosmetic physicians who are non-gynecologists are uncomfortable with the area that we're treating here, namely the vagina. I said it, vagina. And with women being in need of this type of treatment, and with it being one of the largest areas growing in aesthetic medicine, we as physicians need to be able to do it. So,
and especially female physicians.
Absolutely. So in order to bridge that gap where the cosmetic surgeon is uncomfortable with the anatomy, and yet the gynecologist who's also interested in doing these procedures is afraid of the technology, they're unfamiliar with lasers, we can help you there. The V-Spot is helping to establish and cross that gap. We'll come in and assist you in setting up a V-Spot right in your practice, fully loaded with all the machines, all the protocols that I've written for all the treatments, and this way it helps you to bridge that gap and get really involved in female sexual health.
That's really an amazing thing because, truthfully, OBGYN was one of the first things that I crossed out when I was in med school. I'm like, I don't want to be an OBGYN, but because of, you know, my kind of exposure and expertise in regenerative therapies.
Yes.
And then platelet-rich plasma for incontinence. That sort of was my pathway. And then being a lipo doctor, and then
Yes.
fat and stem cells, and then as a dermatologist with the lasers. So the combination protocols. Tell me what your favorite and most effective protocol is for vaginal restoration and rejuvenation.
I love the word restoration. I want to get
too.
rid of cosmetic gynecology worldwide. We're really working on that because it's such a misnomer.
Yes.
So that's number one. Thank
love
you
it. I
for
love it
that.
again.
Thank you
Yes.
for that. It has to be restorative. And the treatments that are ideal, it really depends on what we're treating. Laser is still the gold standard, yet in a very, very young patient who's having vaginal laxity, I wouldn't want to use a laser because how many years will I be doing these procedures? So for that patient, I love radiofrequency, and that comes into play. So using a radiofrequency device to bring back the collagen and elastin to the vaginal walls. And I will add PRP to absolutely everything. It's fertilizer, it's the elixir of life, and it's the way
From
to
head
go.
to toe,
Head to
inside
toe.
and out.
Doesn't matter what you're doing. And you know, I just left the exosome lecture, and I'll tell you, even exosomes are combined with the PRP, and
Why
what
not,
a way
right?
of the future. Yes.
Totally, why
yes.
not? So what's the future for you?
Well, I think that continued exposure of these type of procedures to be more widely available for women, and for women to understand that they're out there. That's my biggest goal. That's my soapbox that I've been on for the past 5-6 years, and I plan on
I
continuing my crusade.
No, totally. I think that as female doctors, I really feel like we have the responsibility to educate the general public. You know, I mean, everybody knows about ED, erectile dysfunction, ED, but I mean, when I talk to media about vaginal health, vaginal health restoration, they're like, no, that's too vulgar. You know, so there's definitely still double standard there, but you know, little by little.
That's correct.
Yeah, so we're making headways, and one of the things that's incredible is the efficacy for these treatments are amazing.
Painless, simple, no downtime, or virtually no downtime. The longest downtime is 3 days of no intercourse. Other than that, the treatments have none. We have something as simple as a chair that you sit on. We call it the Kegel throne, the Emsella. You sit on it, it makes you do 11,000 Kegels.
I've tried that.
Isn't it fabulous?
And it's not painful.
No, not at all. It's a little bit of a tickle, I might say. So
why not? You can get tickled.
Right, so it's a really, really wonderful way of regenerating and building the entire pelvic floor musculature, which will then give us continence in you're fully clothed. So the treatments are widely available now if they're sought.
Absolutely.
And we have to be speaking about them and making them well known. And any physicians who's looking to cross that gap and jump into this field, give me a call. I'll be able to help you there.
Well, thank you for your passion.
Thank you.
Thank you for, really pioneering and helping push this field forward.
Oh, thank you for having me, Tess.
I'm 48, and like I said, I'm so happy that we have these technologies before I reach menopause. And so, thank you.
Oh,
Final
thank
high five.
you.
All
Thank
right,
you
see
so
soon.
much.